Hi, hello friends, welcome to World Explorer India. Today let's discuss about infections and nutritional considerations. Nutrients like vitamin A, vitamin C, vitamin E, omega-3 fatty acids and trace minerals like iron, zinc have a role in immunity, as this will help in maturation of T cells and B cells. T cells and B cells are the cells which help in immunity of our body. Why malnutrition is associated with infection? Because the patient has excessive sweating or fever because of infection, and there is malabsorption of nutrients which is leading to malnutrition, and again it is leading to the decreased immunity. Because of all these situations, patient is at high risk of getting infections because of malnutrition. Let's take an example of typhoid. Typhoid is also called as enteric fever, which is caused by fecal-oral route. Salmonella is the causative organism of typhoid. For this, dietary considerations include high calorie, high protein, high carbohydrate, moderate fat, and high fluid, low fiber and soft diet is recommended in typhoid. And avoid high fiber foods, avoid raw vegetables and fried foods in typhoid. Now some of the nutritional considerations which we should know related to infections. A person with infection excretes more nitrogen than intake because the person is not taking enough nutrition because of the disease condition, and he is in need of, because of increased BMR, the patient may be using more energy in the body, so because of which he may be excreting more nitrogen than the intake. Fasting person with infection rapidly develops a negative nitrogen balance. When 50% of protein stores are depleted, person's ability to recover from infection is very poor. Protein calorie malnutrition leads to opportunistic infections because of the decreased immunity. Loss of mucous membrane integrity as a result of vitamin A deficiency increases susceptibility to bacterial, viral and parasitic infections and also to the respiratory infections. So vitamin A supplementation is needed to prevent the infections. Vitamin C promotes the resistance to infection through involvement in immunological activity of leukocytes, production of interferons and integrity of mucous membranes. Iron overload and deficiency affects the humoral and cellular immunity, which will result in increased infections. Two iron binding proteins, that is transferrin and lactoferrin, these protect the body against infection by withholding the iron from microorganisms. This iron will be used by the microorganism for their proliferation. So these two iron binding proteins like transferrin and lactoferrin are withholding the iron from microbes so that microbes cannot proliferate more in the body. Serum copper levels are increased in patients with acute and chronic infections. Infection is one of the cause for poor pregnancy outcomes in the teenagers. Nutritional counseling to pregnant teens help in decreasing the infections. Glycosuria increases the risk for urinary tract infections. Anemic women is more prone to puerperal infections. Listeria is a known cause of spontaneous abortions and meningitis of fetus and newborn. Uncooked foods, raw vegetables, smoked seafood, contaminated food is the source for listeria infections. Bacterial vaginosis, usually caused by E. coli, Gardnerella vaginalis, can cause premature contractions and early deliveries. So, to prevent this bacterial vaginosis, use of probiotics is recommended during the pregnancy. Human milk contains the specific and non-specific immune factors that support and strengthen the immature immune system of newborn and protects the body against infections. Breastfeeding is contraindicated for mothers with HIV and also for the mothers who are on antipsychotic drugs. Secretory immunoglobulin A has protective function of the gut of newborn against infections. Infections are low in breastfed infants as compared to the bottle-fed infants. Dysphagia increases the risk for aspiration pneumonia, an infection caused by food or fluids entering the lungs. Aspiration pneumonia is food or fluids entering the lungs. So here what we do is, whenever we are giving the rise to feeding, we should ensure the patient is having a Fowler position or semi-Fowler position. Immunocompetence decreases with the age, leading to increased risk of infections, cancer among the old age persons. Hospitalized patients will have increased protein needs. Cranberry juice is proven to be associated with decreased urinary tract infections, as cranberry juice acidifies the urine. Enteral fed patients are at decreased risk of infections as compared to the parenterally fed patients. To reduce the risk of infection, catheter lumen to infuse TPN is to be reserved exclusively for the TPN. No other medicine should be given through the same port. Helicobacter pylori can cause peptic ulcers. So to prevent this, we are using hydrogen receptor blockers as a treatment modality. Secondary lactose intolerance can develop as a consequence of malnutrition. Foods with fiber resistant starches, oligosaccharides may serve as prebiotic foods. This will help to maintain healthy microflora and also resistance to pathogens. Fistulas of GI tract pose a very serious threat for malnutrition and thus cause infection. High fiber diet for post-surgery patients helps in preventing the constipation. Contaminated water is a source of hepatitis infection. Neutropenic patients, they should avoid eating raw foods. Eat only fully cooked foods. Hand washing is strictly recommended. If body weight is 10% less than the ideal body weight, these persons are at high risk of tuberculosis. Malnutrition is complicated consequence in HIV patients. Before surgery, colon should be free of residue to decrease the post-operative complications. This is the bibliography from which I have taken the information. Do subscribe, share and comment for further updates on my YouTube channel, World Explorer India. Thank you.